Okay, so this video we're now going to take a look at the difference between the skeletal muscle, smooth muscle, and cardiac muscle. So there's three main differences here. There's obviously some other differences, but we're going to look at the big three. The first difference is that the skeletal muscle is striated, which means striped. When you look at it under a microscope, it has these sort of stripy looking things on it. It's called striated. Smooth muscle is not striated. Obviously, that's why it's called smooth. Cardiac muscle is striated. So, skeletal muscle is muscle that is attached to bone, as we see the little picture here. Smooth muscle is attached to organs, and cardiac muscle is also attached to organs, but cardiac muscle is only in the heart. That's why it has a special name. So, for example, you cannot find cardiac muscle attached to the stomach or the liver, for example. Cardiac muscle is only in the heart, only. Now, the second difference between skeletal, smooth, and cardiac is if it's voluntary or not voluntary. So, skeletal muscle is voluntary. Voluntary. Why? Because we have the ability to move these muscles. It's voluntary. It's up to us. We want to move our arm, we can just move our arm. Smooth muscle is not voluntary. And that makes sense. The muscles that are in the esophagus, for example, or in the stomach, these muscles we have no control over. We cannot consciously move those muscles like we can move the muscles in our legs or our arms. Now, cardiac muscle is also not voluntary. And obviously that makes sense. We have no control over our heartbeat. The muscles, the cardiac muscle in our heart, it's totally not voluntary. We have no control over that. Now, the third difference between skeletal and smooth and cardiac is which part of the nervous system are these muscles connected to or related to. So, skeletal muscle is related to the somatic nervous system. Somatic nervous system. And smooth muscle is related to the autonomic nervous system. And the heart is also related to the autonomic nervous system. And when you look at the videos on the difference between the autonomic nervous system and the somatic nervous system, all of this will make sense. Obviously, I'm not going to get into that right now, but this is the big picture of what you need to remember. Now, remember, we know that smooth muscle and cardiac muscle, both of these are not voluntary. They are happening automatically. So you want to kind of make a little mnemonic for yourself that these smooth and cardiac muscle, these are automatic. And automatic means we have no control over it. It's just happening without us realizing it. Skeletal muscle is voluntary, and this is from the somatic nervous system. A good easy way to remember is the letter S. Somatic for skeletal. So skeletal muscle is related to the somatic. Both of those start with the letter S. Of course, smooth muscle also starts with S, but again, you want to think about these as automatic. The smooth muscle is related to things in your stomach. That happens automatically. That's how you want to associate to remember those.